19-year-old female with a history medically headaches and gradual visual loss. 1. What is the diagnosis? 2. What is the cause? 3. What is the clinical presentation? 4. What are the main MRI features seen? 5. What treatment is the best? 1. What is the diagnosis? Idiopathic intracranial hypertension, also called pseudotumor cerebri. 2. What is the cause? The exact pathophysiology of IH is poorly understood. Some theories: overproduction of CSF, poor reabsorption of CSF, CSF outflow obstruction. 3. What is the clinical presentation? Headaches, visual problems, transient or gradual visual loss, pulse synchronous tinnitus, photopsia, and/or eye pain. Bilateral papilledema is the hallmark finding. The most important epidemiological factors. In IH are high BMI and female gender. Use of oral contraceptives is also seen. Rare in men 10% and in children. 4. What are the main MRI features seen? A. Optic nerve sheath distension. B. Empty cella syndrome. C. Meckel cave enlargement. D. All of the above. D. All of the above. Optic nerve sheath distension. Enlargement of the optic nerve sheath diameter greater than 6 mm due to increased cerebrospinal fluid CSF pressure, often accompanied by tortuosity of the optic nerve. Empty cella turcica, partial or complete filling of the cella turcica with CSF resulting in a flattened pituitary gland. Common in IH and indicative of chronic elevated ICP. Venous sinus stenosis 80%. Narrowing of the transverse or sigmoid dural venous sinuses, visible on MR venography MRV. Index of transverse sinus stenosis is greater than or equal to 4. Meckel cave enlargement. Enhancement of the optic nerve head. Gadolinium enhanced MRI may show enhancement of the optic nerve head, consistent with papilledema. 45%, range 10 to 80%. Dandy criteria. 1. Symptoms and signs of elevated intracranial pressure. 2. Elevated intracranial pressure. 3. Normal brain imaging except previously mentioned. 4. No other cause of intracranial hypertension. 5. Awake and alert patient. 5. What treatment is the best? Address risk factors such as obesity and medical treatment acetazolamide. Therapeutic lumbar puncture with removal of 30 to 50 milliliters of CSF results in rapid. There are currently 3 surgical options. Optic nerve sheath fenestration NSF. CSF diversion, venous sinus stenting. What is the opening pressure for the diagnosis of definite idiopathic intracranial hypertension? A. 5 cm H2O. B. 15 cm H2O. C. 20 cm H2O. D. Greater than 25 cm H2O. D. Greater than 25 cm H2O.